And now for our next speaker, Dr. Bret Trusko. He is an experienced educator, researcher, and consultant in new product development, innovation, academia, and consulting. He has worked with more than 50 healthcare, life sciences, and technology companies worldwide to plan, develop, and execute innovate strategies, as well as to find new ways to use existing technologies. Dr. Trusko has written hundreds of articles focused on how to impact organizations through the innovative use of technology. He has also served as principal investigator, doctoral researcher, and faculty at several universities throughout doctoral dissertation and instruction at Mayo Clinic College of Medicine, Golden Gate University, University of San Francisco, University of Minnesota, University of Phoenix, Marquette University, and Houston Baptist University. His book, Healthcare Excellence, Improving Quality and Cost Through Six Sigma, was released in 2007. And his new book, The 7 Deadly Errors, is in publication. During the last several years, he participated in more than 50 seminars, both domestically and internationally, for groups such as American Hospital Association, American College of Healthcare Executives, the Healthcare Financial Management Association, the United Nations, and the Henry J. Kaiser Family Foundation. His clients include Microsoft, the British Broadcasting Corporation, Georgetown Medical Center, California Pacific Medical Center, Virginia Medical Center, French Telecom, the Bin Said Group, Kuwait Airways, and many more. Dr. Trusko holds a BS in biology from Brigham Young University, a BBA in accounting from the University of Alaska, an MBA in marketing from Pacific Lutheran University, and his PhD in information technology management and business administration from Golden Gate University. And now, without further ado, I present to you Dr. Bret Trusko.
Thank you, Rick, for the introduction. It's a pleasure to be here today. I am, as Rick said, Bret Trusko, and I work in healthcare for a number of years in healthcare innovation. So I have been covering innovation in healthcare for many, many years, and I've actually worked in innovation since I was a kid. The innovation in healthcare is one of these kind of interesting dilemmas. Because on the one hand, when you think of healthcare, some people think that it's probably the most innovative industry that exists in the world. When you think about curing diseases and some of the technology like CAT scanners and PET scanners and immunizations, you think that innovation is a big part of it. But at the same time, if you look at it from another perspective, it can also appear to be maybe one of the least innovative industries in the world. Well, you know, I've been in healthcare, like I said, for my whole life, and today I'm going to talk about some of the problems and some of the infrastructure type things that really affect healthcare and make it difficult to be innovative. But before that, let's step back a minute. You know, we've all heard that back around 1998 or 1999 that the Institute for Quality basically identified 100,000 deaths a year that were caused by medical errors. Now, when we look at these same reports 5 years, 7 years later, those numbers haven't changed. And why hasn't healthcare quality improved in all those years when supposedly this was something we were focusing on? Also, in the United States, we spend approximately 1/6 of our gross domestic product on healthcare. This is a huge number any way you look at it. Defense is the only number that's larger than healthcare spending. And even when we look at healthcare spending, you know, the nice thing about defense is in defense we can control how much we spend to a certain extent, as long as we're not involved in a war or some conflict somewhere. In healthcare, the costs just keep rising, and we can't seem to stop them. At some point, relatively soon, we're going to reach 20% of the gross domestic product that we will be spending on healthcare. And we're not getting any better results than we have before. And in fact, in the United States, in many respects, we're getting worse results globally than countries that have socialized medicine, for example. Add to this that we've also got 40 million people in the United States that have no health insurance at all, a number that's basically projected to continue, with the exception of now the Affordable Care Act, which gives us potentially, or as they say, the opportunity to bring this number under control. However, as we've seen over the last several years, what's been going on in healthcare is that we as the patients, as the consumers, have been footing more of our own bill. Anyone who's paying for their own, for some portion of their insurance at their employer is seeing that it used to be you didn't pay anything. Now, in some cases, you might be paying half of your premiums. In my case, I'm paying more than 50% of the premium if I was to go out on the private market and look at it. So, we're starting more and more to foot our own bill. And so even if we go to the Affordable Care Act, we may be individually paying even more than we are now to support another, the group of uninsured patients. Now the theory, of course, is that healthcare expenses will go down, and I personally kind of prescribe to that theory that if everyone's covered and everyone is able to achieve insurance and preventative care, that that the cost should go down over time. But that's yet to be tested, and there's a number of people that disagree with that. We'll see. So why doesn't innovation happen in healthcare? Well, first, a few facts. As I mentioned before, healthcare is the number 2 funded R&D in the United States behind defense. So, in fact, there is a lot of money being spent on innovation and research and development in healthcare. Another fact is that private spending on healthcare R&D is also in the tens of billions of dollars. So not only is the government putting a lot of money into healthcare innovation, but so is the private sector. In fact, also, behind information technology, healthcare is the number 2 angel-funded startup kind of industry in the world. So there's money going to healthcare from the government, from the private sector, and from the investment community. But despite all of this investment, several notable failures continue to punctuate the healthcare landscape. For example, in the 90s, we tried managed care. Managed care, HMOs, were a dismal failure. We've had many well-known biotech failures. We also have had a lot of efforts in trying to defragment physician practices, which hasn't been happening. Poor quality continues to be a significant problem in healthcare. There's insurance fraud that we can't seem to get a control on. And the current backlog of claims at the Veterans Administration has been notable in the news over the last few weeks, that new vets coming back from Iraq and Afghanistan are sometimes having to wait 2 or more years. I think it's 2 years on the average now before their disability claims can even be processed. Why does this kind of stuff happen? And what are those challenges to healthcare innovation? Well, I think there's a number of them. The first one is the interplay of multiple actors in healthcare. For example, we have many industry parts. We have physicians, we have nurses, we have the government, we have the insurance industry, we have employers, and all of these people have their own interests in mind. For example, one notable competing player or actor group is the tort lawyers against the American Medical Association. If you actually look at the arguments on both sides, they have valid arguments, and they're both right in their own perspective and how they see things and the facts they lay out, which basically means that they're looking out after their own, and that's what they're supposed to do. Other ones are the other constituents is, for example, academic medical centers and community medicine, specialists versus generalists, political parties and how they see the world and how healthcare should be funded. All, as I said, making valid arguments for why they're right and why the other side's wrong. and because the industry is so large, having a gigantic stake in failure. So having multiple actors, more so than in any other industry or any other business that exists, causes our own set of problems with healthcare. Add to this the funding models that we work under in healthcare. They're very complex. If you think about your average retail business, you've got a customer and you've got a business. In healthcare, you've got multiple customers. Some pay their bills, some don't pay their bills. You've got many people paying. I've been at hospitals before where they have over 100 paying insurance companies with over 50,000 patients a year. This creates a situation that's very difficult to manage from the payment perspective. And we've all seen, tremendous, the other interesting question with the funding models that I've noticed lately that I think is fascinating is if you look at things like dentistry over the last several decades, if you look at relatively new things like LASIK surgery, cosmetic surgery, the cost of those treatments actually have been going down over time. The quality in those treatments have actually been going up over time. And you can attribute this to the fact that that the patient pays directly. Insurance almost never pays for LASIK surgery. They don't pay for cosmetic surgery. And for the most part, dentistry is covered by the patient themselves. So what we've got here is we've got consumerism to its fullest extent happening in some pieces of healthcare. The cost is going down, the quality is going up. But I would challenge you to be able to shop around like you do with cosmetics or LASIK or dentistry when you're having a heart attack or a stroke. Now, all of a sudden, you have to go into the control of the system, the insurance companies, whichever hospital happens to be near you, and that makes it a lot more of a challenging problem. So what you're prescribed, where you live, makes a big difference. Additionally, on funding models, we've got problems around what is approved and what works out in the funding process. For example, drugs these days can take 10 years to have approved going through the FDA process. So if you're someone who's investing in innovation in drugs, you need to be willing to be able to sit back for 10 years and wait for your drugs to be approved. HIPAA causes interesting situations. If you're inventing software in healthcare, you may be subject to having your software validated. So it creates an interesting challenge for people who are doing this. On the flip side, when you're also having problems like heart attacks and stuff, you don't want to make decisions. So the models are very interesting in how they're funded, and so we will continue to have those challenges in healthcare. Public policy can be something that aids in innovation or actually detracts from it. For example, evidence-based outcomes, which is what they're talking about in Affordable Care Act, is basically the concept of taking all this data that we have and starting to make decisions based upon good information. An innovative individual would say, this is good because this gives me an opportunity to get into big data, gives me an opportunity to really invent new things around all of this new data that we're collecting around the electronic medical record. Now, on the other hand, and public policy being an issue, you have HIPAA, which says that while this data may exist, the innovator may not be able to get to the data because it's locked up in a hospital that you can't get to. Then we have the reasonable use or the meaningful use criteria, and those those basically play in the favor of the large electronic medical record companies, and once again acts to lock up that data so that innovation is stifled in that space. But we also, if we look at HIPAA and if we look at meaningful use, the intentions are good. HIPAA has really great intentions, but once again, it tends to act to lock up data that we could use for innovation. So, public policy can work against you. Technology, technological developments in healthcare can be particularly challenging to the innovator. And that is that if you're in too early in a technological advancement, you really run the risk of the other 6 factors acting against you. For example, if you encroach on a space that someone else already has, let's use, for example, an electronic medical record, you've already got large EMR companies that have now established themselves as meaningful use providers. They've got a lot of political clout. There's a long process to make sure that your software operates the way it's supposed to. So you have very large hurdles. Investing in something early, even if it's a small piece of an electronic medical record, maybe a new way to monitor some disease or something, you could be basically taken up by a larger company. You could find hurdles in public policy, saying that, well, only this company or that company can do it. Many factors that make it risky to do it. And as I had talked about with public policy, we could be talking about Medicare and Medicaid working against you. And so you kind of have a buggy whip problem. And I always ask this, people kind of challenge them to say this, with all the entrenched companies and financing, funding, public policy in healthcare, I always wonder kind of what would happen if someone actually, all of a sudden today, an innovator came up with a shot that could cure all cancer. Well, I live in Houston, Texas, in the MD Anderson Cancer Center. That's all they do is cancer. Would they work against you or would they work for you? Because essentially your shot could put them out of business, plus a whole heck of a lot of people in that industry. It's an interesting thing to ponder. I'm not saying that I've heard that anyone's inventing anything like that anytime soon, but it really, as an innovator, you've got to consider the entrenched industry that healthcare is in, and how do you make your way into that. Another interesting part of healthcare problem is the patient / customer / whatever you call them. Once I read, I think everyone's read on the internet, no one knows that you're a dog. And so since the advent of the internet, and I wrote some articles on this back in the late 1990s, I really thought patients were going to start taking a more active role in their healthcare. And unfortunately, some of what I've seen is that you have a few different kinds of patients that are involved. You have the group that's probably overactive in their healthcare, and they go onto the internet and they research their disease and they read all sorts of strange and sometimes illegitimate treatments for their diseases, and they come back to their doctor and they don't want to listen to them. And you couple this with, I think everyone knows there's been an eroding of confidence in the professions. So so you have this eroding confidence, you have the internet, you have people who aren't necessarily trained, who are trying to take care of their own treatment. In many cases, these patients are maybe too active and don't really pay attention to legitimate treatments and legitimate things that their physicians say. Alternatively, there are patients who are, I'll essentially say they're too passive and they'll do anything the physician recommends. And so we've got all this great opportunity for the informed consumer, but they don't necessarily want to be they don't necessarily want to know what's going on with their treatment. Then there's a third category of patients, which I find to be the really unfortunate group of patients, and that is that those are the people who still believe that healthcare technology is great. I can eat what I want, I can not exercise, I can drink, I can smoke, anything that I want to do, and there's going to be a pill or a shot or a procedure that will fix me. So I don't have to be, so I'm not a passive consumer, I'm not an active consumer, I'm just an irresponsible consumer of healthcare. And those, I'm not even sure what we do about that. Another interesting thing in healthcare that's working against you is consumers and patients are increasingly demanding accountability from the healthcare system. Unfortunately, they're usually met with resistance from well-entrenched groups that are already claiming accountability. Recently, there was in the news the case of a physician in Pennsylvania who was doing late-term abortions illegally. What personally shocked me about this story was the clinic was allowed to self-report for, it sounds like, 10 years. No regulatory authority looked into their records. No one came by. No one checked this out. No one took accountability for this physician's actions. I have looked at with interest at some of these reporting groups, and let's use Consumer Reports as an interesting example. Consumer Reports has a report that they do on the best hospitals in the United States. But what I find interesting is when Consumer Report actually wants to report on automobiles, for example, they get one of the automobiles and they drive it, and they might crash test it and check the mileage personally, et cetera, et cetera. What they do in the case of hospitals is they take government reported data and they trust that data and they don't do anything to confirm it. Some of that data, for example, that I find really kind of questionable is, for example, one of the criteria for quality is readmission rates. So a hospital reports its own readmission rates. In theory, being readmitted is a bad thing, but you have to wonder if sometimes readmissions aren't necessary and people are not being readmitted when they should. So it's not a perfect measure, and most of the measures for quality in hospitals aren't that good of measures. There's also this idea that more admissions means you do a better job. In theory, I suppose the more you practice, the better you play, but I don't know that that's a sound way to say whether a hospital is of higher quality or not. Also on the accountability front, they have the Joint Commission on Hospital Accreditation, and the interesting thing about that is they actually go look at hospitals and they say this is a quality hospital, but what they basically do is they're an organization funded and run by the healthcare industry that signs off on their own members. It does fit a place, but the accountability is not being probably where it should be. So we've got a lot of interesting accountability issues in healthcare. Insurance companies, doctors, hospitals, drug companies, and it's sometimes a little hard to do that. So in an industry like this, how does one actually innovate in healthcare, which is what this conference is all about anyways? I really have two things that I think is most important when you want to innovate in healthcare. And the number one is recognize and clearly understand the industry you're working in. Because of all the complicated factors that are making it difficult to innovate in healthcare, you really need to understand the industry. And number two, which is probably the most important thing, is to utilize those industry forces in your favor. So instead of actually trying to give you a Innovation 101 lesson, why don't we talk about groups, people who are actually being successful in innovation in healthcare. The first one, let's talk about these minute clinics, or these clinics that are showing up in suburbs and away from hospitals. I'll say minute clinic, but I'm kind of grouping a whole bunch of these kind of organizations together. Minute Clinic, for example, is located in Target. And if you haven't used them yet, you can go in, you can get your immunizations. If you have a sore throat, someone will see you. In my case, and they're in CVS also. I think they're in CVS also. In the case of immunizations, my personal experiences, I work in a medical school, and when I walk into the hospital, once immunizations become available, they look at my employee ID, and if I don't have the special sticker on it, they pull me aside and give me my immunization. But in the case of my family, actually trying to book an appointment at a physician's office or go to a hospital to get an immunization is quite honestly, barbaric that you would have to do that. So my family, they might be shopping at the store and they see that they've got immunizations available, and they walk over and they get it done, and they show the insurance card and they have a free immunization. But we want to stay away from the doctor. I have an example. My wife decided she needed a physical. She booked an appointment, the first appointment of the day, I might add, with her physician in the big physician's office building next to the hospital. And she showed up for her 9 a.m. appointment, like I said, which was the first appointment of the day. And she was told the doctor was already running 2 hours late and that she'd have to wait. My wife probably none of you know her, but she's a high-power executive. She makes a lot of money per hour. She has a lot of organizations that she's responsible for. For her to wait around for 3 or 4 hours was a gigantic inconvenience for her. Places like the Minute Clinic cater primarily to commoditized services, and while they don't do physicals, there are other ones that might do a physical for you. But the point being that the traditional models of healthcare sometimes just don't work for people. Up at Mayo Clinic, they have executive treatments where they are executive things, medicine, where you can actually go up and they'll run you through everything you need in one day. Now, granted, you have to fly to Rochester, Minnesota to receive it, or they probably do it in Florida and Arizona where they also have clinics. But it's still a difficult process because it's not very convenient. What I find interesting from this perspective is that these hospitals don't actually seem to care about these commoditized products. They're not high margin for them. And so you might argue that the Minute Clinics are chipping away at the monopoly of the healthcare system. And of course, we all know that if this happens, they chip away a little more, and then eventually we might see something. But at this point in time, they don't really compete against the hospitals or the doctors, since they deliver low-margin, high-volume services such as triaging ailments, strep throat, bladder infections, vaccines. And the real backlash that's happened so far is physicians claiming that because these Minute Clinics have nurse practitioners that they might not spot serious conditions. However, I would argue against that to say, well, if I've got to come in and wait 3 or 4 hours to see a doctor, I probably just won't come in. So even having a nurse practitioner see me is better than not seeing anyone at all. And this is my experience throughout the United States, that it's difficult to see a physician. Device manufacturers are another example. What's happened over the years in device manufacturing, and I believe Medtronics is a good example, is they've decided that the best way to get through some of these problems is not to just introduce a device and then try to get it through the FDA, try to introduce it to the hospitals and the doctors. What they've done is they've started to partner with the hospitals and the doctors. So they've already won over an important constituency. They've done the testing. They have the friends that they need. They've gotten some of those actors to work with them to help them develop new products. Another interesting example is the Hospital Corporation of America, or some people know it as HCA. And what the HCA has recognized is that to go into a large urban area, any large city, would not be something that people, an organization such as them, would want to do. I would challenge anyone to go into Manhattan or San Francisco or Chicago and try to open a new hospital. But what's been happening over the years is some of these larger hospitals have started to really draw in a lot of the specialty cases, which has kind of left a lot of rural environments to their own devices. And we've seen a lot of hospital closures and basically healthcare withdrawing from the suburbs. Well, what the big cities have, of course, is they've got a captive audience. What the small towns had in the past was standalone hospitals that really couldn't function in a very complicated environment that we're describing. So the innovation that HCA has done, and other organizations like this, is to say we have an underserved market in the rural areas. If we set up a large organization with 250 hospitals and we start to centrally manage the management of the hospital, rotate professional managers in and out, standardize everything, then we have an opportunity to take a market that the big players and the large money makers who need high margins have started to ignore. In many ways, this is kind of like the Minute Clinic concept. Find out where the large players don't particularly work very well, and go do something that's being underserved. Take care of a market that's underserved. Take care of a patient that's underserved, and capitalize on it. As accountable care organizations develop, there will be other opportunities for developing and managing wellness and access. This is not to say that healthcare providers will make the mistakes of the managed care era, where basically they restricted healthcare access, both implicitly through longer wait times or explicitly through denial of care. Instead, I'm hoping that this is going to lead to a whole new outbreak, shall we say, of innovation, where having the responsibility for a patient's health is going to include diet, exercise, evaluation of risk through genetic sequencing, and a more complete understanding of all the determinants of health. And when you look at those determinants of health and where innovation opportunities are available, one could argue that number of doctors, the type of reimbursement system you have, education levels, lower domestic violence, treating childhood obesity could all start playing into that. And that starts to open up a whole lot of areas where innovation could really take place. Now, another real dilemma in the healthcare is in the U.S. system is that it's seriously flawed in many ways, but then single-payer systems are also flawed. So there's no really any best system. For example, in the U.S., we're very responsive to technological change. This is where most of the medical breakthroughs happen in the United States because we pay well for technological innovations. Now, I'm talking about delivery of care, not necessarily financially or anything else. While the single-payer method of payment tends to be very poor at technological innovation. There's no real incentive to bring in new technology because you're not going to get paid anything else for it. Treatment of the whole individual, on the other hand, probably has a better chance in a single-payer system because they're incentivized for keeping costs low and keeping people healthy. Whereas in the United States, we pay well for procedures, but we don't pay so well for keeping people well. While neither system is great, one of the great things we have in the United States is that with the right incentives, we can treat the whole patient and we can actually enhance things. I don't know if anybody uses OpenTable, but one of the things that's great is, for example, it connects thousands of restaurants, and I'm known to abuse OpenTable because what they do is when you make a reservation, they give you points, and at some point you get a check or you get to use points at a restaurant. So I tend to abuse the system because I'll go in and I'll say, "You got any tables?" And I'll say, "Hold on a second," and I'll make a reservation on OpenTable right on the spot so I can get my points, even though I'm standing in front of the hostess. So when you think about, well, some of this technology we can apply, we can always game the system. For example, if we were to have lower insurance rates for going to the gym, well, we could always go to the gym, check in, and then go home and never exercise. But, what the heck? We're hoping that once you get to the gym, you might actually exercise. So some of the arguments against some of these incentives, they're decent arguments, but they don't really hold up over time. But other models that we might look at in incentivizing patients to be healthier, let's just say healthy food. I think we like to think that that people don't really know what we're doing, but every time you go to the grocery store and you buy your groceries, somebody knows that you bought healthy food or unhealthy food. If you start to expand the system and give incentives and you tie it to your grocery store shopping, you tie it to attending the health club, something like that, then you may have opportunities to innovate there. Once again, this is one of these markets where it's really no one's doing anything with it. It's an underserved market. It's got big data. And you really wouldn't be fighting against the entrenched players in that market if you were doing that. Sure, you don't have to eat the healthy food, but if it's in your house, you might actually do it. So, from the perspective of healthcare innovation, the best innovators will recognize the forces that are working against innovation. and find the places where they can help. This might be, as I've used as an example, and we know in innovation nobody has all the answers, but it might be in big data analysis. We're collecting so much data in so many places. How can we apply that to healthcare? We have a push for alternative delivery strategies. We have new places to deliver care. We have incentives for wellness. We now have accountable care organizations that care about keeping you healthy. And none of this actually plays against the entrenched players in healthcare. So it gives us lots of great opportunities. So once again, just to reiterate, we have market forces that work against you in healthcare. In healthcare innovation, there are lots of still underserved markets. If you understand your healthcare market and you don't try to take on those forces that work against you, but try to find those places where there are opportunities. The Minute Clinic offering convenience on low-margin products that hospitals and doctors don't necessarily want to deliver. The medical devices finding new partnerships to innovate in healthcare, or the Columbia HCAs finding, once again, some place that no one else is that interested in. It makes it much easier to innovate, and with that, I hope that you can find some strategies to successfully innovate in healthcare. Thanks.
Incredible, Bret. What a great presentation on innovation for healthcare. I hope everybody got tremendous knowledge out of that presentation, and I am just so excited that Bret was able to be with us here today. And now, stand by for our next presenter.